This is about DUE or DUR. DUE means drug utilization evaluation, and DUR means drug utilization review. Uh, this is a process used by pharmacists to evaluate a patient medication regimen for potential drug interaction, duplication, or inappropriate dosing. Its definition is: it is an ongoing, authorized, and systemic quality improvement process that will ensure that medicines are used properly. It is quality insurance management activities for drug therapy. Its aim is to promote rational drug use to improve drug therapy outcomes. It is used in medical prescribing, pharmacy dispensing, usage of drug by patient, and objectives or goals: to reduce risks of ADR, to promote rational drug therapy, to improve drug therapy outcomes, to reduce risks of drug toxicity, to identify drug interaction, to understand pattern of prescribing of different doctors, and also economical use of the drug. Classification of DUE: it is of two types, that is qualitative DUE and quantitative DUE. Qualitative DUE determines quality of drug use and drug therapy outcomes. Next, quantitative DUE. It determines pattern of drug acquisition, prescribing, dispensing, distribution, and consumption. This is the cycle of DUE. It is of 7 steps. First one is planning, second is data collection, third one is evaluation, then feedback of results, then intervention, then reevaluation, then feedback of the result. These are of 7 phases and 11 steps in DUE cycle. First phase is planning. In first phase, first step, that is in this, identify drug of areas of practice for possible studies. And second step is design the study. Third step is design criteria and standards. Fourth is design the data collection form. Phase 2. In phase 2, implementation and data collection. In phase 2, step 5, you have to collect data. And then phase 3, data analysis and evaluation. Step 6, that is collect data and evaluate the result. Phase 4, feedback of the result. Step 7, feedback result back to clinicians and other hospital staffs. Phase 5, intervention. Step 8, develop and implement intervention. Phase 6, that is re-evaluation. And step 9, that is re-evaluation to determine if the drug use has been improved. Step 10, reassess and revise DUE program as needed. Step 7, feedback of result. And step 11, feedback of result to clinician and other hospital staff. Now the phase 1, planning. In step 1, that is identify drug or therapeutic areas of practice for possible studies. In that, common target for DU includes commonly prescribed drugs, drugs associated with potentially significant drug interaction, expensive drugs, drug used in high risk patient, drug with narrow therapeutic index, drug used at high risk patient. Okay, in step 2, design of study. It may be prospective or retrospective or concurrent. In prospective, uh, evaluate a patient planned drug therapy before a medication is administered. And retrospective, uh, in this, after completion a course of the therapy. Step 3, that is design criteria and standard. After DU target has been selected, it is important to conduct a comprehensive literature review, that is criteria and standards. Step 4, design the data collection form. Patient demographic details, prescriber details, disease severity, indication of drug use, contraindication, side or adverse effect, dosing information. should be collected. Drug and drug food interaction, monitoring of drug therapy, cost of therapy, it should be collected. And then in phase 2, that is implementation and data collection. uh, in step 5, that is data collection, data collectors should be chosen carefully and should be familiar with how information is arranged in the patient case note, like clinical chart. Sources of data is patient treatment chart, patient admission record, pathological record, departmental audits, microbiology data, demographic data, administrative data. In phase 3, data analysis and evaluation. Step 6, collect data and evaluate result. The data obtained should be collected using available resources such as spreadsheet, databases, and word processing. Phase 5, feedback of result. Steps 7, feedback to the clinician and others medical staff. The report should be a well presented and well reasoned document with no grammatical or typographical error. Phase 5, intervention. Step 8, develop and implement intervention. Educational implementation, that is educational meetings, newsletter, posters, academic detailing, and circulation of protocols. Operational implementation, formulary addition, modification of the drug order forms, prescribing restriction. Phase 6, reevaluation. And step 9, reevaluations to determine if the drug use has improved. The reevaluation is done 3 to 12 months after the introduction of the intervention. Step 10, reassess and revise DUE program as needed. The question address should include, did the program address important aspect of care, where the criteria develop appropriate, where drug use problem identified. Phase 7, feedback of result. Step 11, that is feedback to the clinician and other medical staff. Role of pharmacist in DUE, that is program development, supervision, and coordination, education of hospital staff, promotion of goals and objectives, development or review of audit criteria, development of data collection for instruments, planning, organizing, and implementing a DU program, publication of result in peer-reviewed journals, documentation of program outcomes, effectiveness, and cost benefit, presentation of DUE results at conference and meetings.